Hi guys, I hope you're having a good morning, a good afternoon, a good evening. I'm Savannah Gibson and I'm going to be talking about chronic obstructive pulmonary disease, which you'll hear me periodically say COPED, just because it's the abbreviation for it. I am in a one-person study room, so if you hear any coughing or talking or anything like that, these walls are super thin, so I just want to let you know in advance, and that I apologize in advance. So this is everything that we're going to be going over today: signs and symptoms, causes, diagnostic testing, and everything that we wrote our paper about. So what are the signs and symptoms to COPED? A lot of it's going to be trouble catching your breath, producing a lot more mucus, can't exercise as well as you used to because you're just trouble catching your breath so much, even losing more weight than you mean to because you're coughing so much. Even swelling ankles could all be a part of it. And this source is found by the Mayo Clinic and it was published in 2024. So this is fairly recent that all of this has come out. And if you want to, this is straight from my paragraph and just tells everything that you go through when you first start having COPED. Next is the types of COPED. I added this in here because they affect you differently, the different types. So the first one is emphysema. I can't pronounce it, but if someone wants to correct me in the comments, you're more than welcome to. So this is where it'll affect your alveoli, which we know that name before. It's because it's our respiratory system and we've learned about it before. But this is where your sacs sit on your respiratory system and they get damaged and they can't pass through oxygen to your blood anymore. So by doing that, you could have trouble breathing. And the next one is chronic bronchitis, and this affects your bronchioles, which is just your tree-like, tube-like structures. They're tubes that bring oxygen to your body as well. And they become inflamed and they produce mucus. So any clear, white, green, brown mucus that you see is coming from your bronchioles. And that was from Cleveland Clinic 2025. That was from Mayo Clinic. This is from Cleveland Clinic 2025. So the causes of COPED is any type of smoking. So if you're smoking, if your partner smokes, if your parent smokes, if you're breathing in fumes from work, any secondhand smoke is considered smoking when it comes to chronic obstructive pulmonary disease. So what's your diagnostic testing going to look like? So when you go to the doctor or nurse practitioner, they're going to do just a regular health assessment on you. They're going to ask for your weight and height and take that down. And then they're also going to listen to your chest with a stethoscope, and they may hear wheezing, popping or cracking sounds, anything like that, just depending on how severe it is. And after that, they'll go through several different tests, just depending on how severe you are and what they think is best. So what you may go through is a pulmonary test. And these different tests look like spirometry, lung volume test, lung diffusion test, pulse oximetry, or exercise test. And all this information is coming from the Cleveland Clinic. Next, you could go through a lab test. I tried to get the most cartoony blood picture I could find. So if anyone is affected by blood, I'm so sorry. So these are just going to be your lab tests. So it'll be an arterial blood gas analysis, an AAT deficiency test, or a blood test. And then your next test that you could possibly go through is a CT scan or a chest x-ray. So your treatment to COPED could vary. One of the number one causes to end COPED is to quit smoking and to stop being around smoke. Next would be therapies, medications, or surgery. And those vary. It is definitely a one size fits all, and these are all different prices, so you can find what fits best for you and of course what your nurse practitioner or what your doctor says. So some of these medications and therapies could look like inhalers, nebulizers, bronchodilators, inhaled steroids, combination inhalers, oral steroids, phosphodiesterase 4 inhibitors, theophylline, antibiotics, oxygen therapy, pulmonary rehab programs, in-home therapy, and surgery. So any of these can fit for you on how severe you are and what you're going through. So diet at home is actually a huge deal when it comes to COPD. A lot of this is your protein. So when you are having trouble breathing, you breathe in more because you're having trouble breathing. And because you can't seem to get enough breathing because your breathing is inhibited, you need a lot more protein. Even your lungs need protein too. They have strength. So you're going to eat twice the amount of protein that you normally do, and even 10 times, just depending on how severe you are. And this is all coming from Association, the website Association. So this could be getting in eggs in the morning, chicken, steak, beef, anything like that will help you get your protein intake in. Also, you're going to want to get 20 to 30 milligrams of fiber. That says grams. No, it says milligrams. Okay. 20 to 30 milligrams of fiber daily. This is going to help you clear that mucus and to help with that. And you're also going to avoid any type of sugar. This also includes carbohydrates, any type of candy, sugars, anything like that, because it makes your body more inflamed, and that even makes your tubes in your bronchioles more inflamed. So with that being said, you're going to want to avoid all that to try and get that down to how it is normally. So then your prognosis. What Whitmore said in 2023 was that most people who die from COPD suffer from pneumonia or respiratory failure, and some can even live up to their 80s or 90s with COPD. So I know people with COPD, and they are doing just fine with treatment, and they are able to live with it. So it's not going to be an end-all be-all if you have COPD, but also at the same time, you're going to want to try and keep away from any type of respiratory disease or sickness that you can. Obviously, bronchitis, COVID, flu, anything that has to do with coughing or anything like that, you're going to want to stay away from, just because you don't want to make yourself more sick. I hope you guys had found something interesting or learned something today. If you have any questions or comments or concerns, you're more than welcome to leave them in the comments. And if you have any constructive criticism, I'm completely open to that as well. I hope you guys have a blessed day.